All right. Good morning, good afternoon, and good evening. Welcome whenever you are listening to this podcast. My name is Erwin Ho. I'm a microbiologist of host ZNK here in Turnhout in Belgium. This week I'm going to talk in English, and considering one of the things I talked about last week, it will be quite clear quite quickly why I have done so. Because I'm going to talk about hepatitis B and also about the vaccine and what's going on in the States. But first, like every week, I'm going to have a look at the Belgian surveillance data in terms of respiratory infections. And currently, we are in the 12th of December. So Christmas is almost upon us, and the Christmas decorations have been put up on in our office here in the hospital. And the trend that has been going on the last weeks is currently continuing. So we have RSV, which is currently present in the sewage water, which is the early warning indicator, is rising, and also incidence in both children from age 0 to 4 and also in adults has breached epidemic levels. Also, what we also see is that confirmed cases of influenza is also rising, as is the sewage water indicator, which is also rising. So currently, Cienzano in Belgium is still sitting on a green level in terms of the status and the measures that we need to do in the country. But I do expect it to go to code yellow next week. This is also something that has, I've discussed this with my colleague, Dr. Dana van Kerkhoven, and she's confirmed these sentiments, and she actually sent an email to our colleagues here in the hospital in ACIP Turnhout, warning of the increased incidence of these infections. There's also a norovirus infection, an outbreak going on in a care facility nearby, which also could explain a higher incidence of norovirus. So there's a lot of virus circulating right now. It's a little bit later than we would expect, but it has started after all. So again, personally, I do think that next week we're going to go to code yellow, which would imply if you have respiratory symptoms, either patient, a visitor, or personnel, then we would ask you to wear a mask. And also, if any of our personnel is caring for a risk group patient, so over age of 65 or immunocompromised or very small children and pregnant patients, then we would also ask to wear masks. But communication notes are being prepared by our hospital, and that will be activated once the government does activate code yellow for us in Belgium. So the reason again why I'm talking in English this week is again what's going on in the States. So to recap, to summarize, so last week on both Thursday and Friday, the ACIP or Advisory Committee on Immunization Practices has issued a guidance which would limit the birth dose of hepatitis B vaccination in newborns, to newborns from hepatitis B surface antigen positive mothers. So they would roll back the universal vaccination of hepatitis B. As I explained last week, I think this is a disastrous decision, and I completely disagree with that. And leading up to this podcast of this week, I've actually taken the time to watch this committee hearing, because it's still a government institution, so everything is publicly available, and I've watched that. But to preface that first, because this is 2025 and we are living in the presidency of President Trump, I will fully disclose my own activity and my own background. So I have done a PhD on viral hepatitis, specifically on the elimination of chronic hepatitis B, C, and hepatitis E. I have personally spent over 10 years on the subject. And the doctorate is publicly available from the University of Antwerp. And to just also give additional context and a little bit of story time, is I remember when I reached out to one of my promoters, so Professor Michielsen, when I had an interest in pursuing academic activity. It was actually after a class that he organized on gastroenterology, where he needed a little bit of help on a study he was starting on hepatitis delta. I mean, I was a 23-year-old medical student. I didn't know anything about how the scientific world and academic world, how it operated in medicine. But yeah, I was able to follow my promoters. I was invited to, of course, read a lot of literature, to also write a couple of papers, to perform experiments, to go to scientific meetings and also symposia and stuff. And yeah, throughout the years, I could learn a lot. I mean, I can hear all this data and presentations, and I can have interactions with colleagues. And whenever you're a scientist of any niche, I mean, that's how you go into these activities, right? I mean, you don't just believe anything that's presented face value. Of course, you have a healthy dose of skepsis, and you will adhere to scientific rigor, and you will hear multiple opinions. Of course, the primary ones when you're a junior scientist, you listen mostly to your peers and also to your supervisors and your promoters, but you're influenced by all kind of scientific inputs along the way. And in each scientific meeting or symposium, there's always a discovery. You learn something new. Like you had a preconceived notion of something, or there was something which was established in the scientific community, and then there's a breakthrough study or something which shows something new, and then it's confirmed by multiple other groups, and then you have a revolution. In our field, in viral hepatitis, the revolution that happened when I was doing my PhD was the cure of hepatitis C. I mean, I remember when I started my scientific activities, like I think my own professor said, like, hepatitis C, we cannot cure this. I mean, this virus, just like hepatitis B, causes chronic infection, but the virus mutates too much. We cannot vaccinate against it. We have no effective ways to manage it. While as opposed to hepatitis B, during that time, there was a development of very effective antiviral drugs, which were able to suppress the virus. So everyone thought, okay, hepatitis B is on the horizon. We may cure that, but hepatitis C never. And in the last 10 years, they did find a cure, and it's effectively, I mean, it's not fully cured, but we have a finite medication that will really get rid of hepatitis C. And one of the most spectacular results comes from Egypt, a country that has had a very recent and tragic burden of hepatitis C, because a huge part of the population had contracted hepatitis C because of a national program to vaccinate against schistosomiasis. And a lot of people contracted hepatitis C. But when they found that cure, they used a similar government systems to provide mass treatment, and we have spectacular results coming from that country. So that's just a very long preface to tell, okay, when you're in the scientific community, you learn from each other, etc. Also, when you have outside big symposia and scientific meetings, when you have panel discussions, to which I was invited to, one of them, because like I studied in the University of Antwerp, and in this university, in the University of Antwerp, one of my actually co-promoters is Professor Van Damme, Pierre Van Damme, he's one of the driving forces and founders of the Viral Hepatitis Prevention Board, which is a WHO supported, as the name says, hepatitis working group. They've worked for decades around viral hepatitis. And I also remember when I was a student and I heard about hepatitis B for the first time, about vaccination, I still vividly remember a presentation from Professor Van Damme, who is a colleague now. I remember it being very clear, very interesting, very enlightening, and etc. But I was actually invited to one of their working meetings, and actually I got the opportunity to present some of my own preliminary data on that forum. And I mean, this is like a panel of international epidemiologists, physicians, hepatologists, scientists, people also from the CDC and from the United States and NIH. And I remember these meetings, first of all, being very cordial. Everyone was very friendly at these meetings. But at the same time, everyone adhered very strictly to scientific rigor. The discussions were sometimes quite direct, but always very collegial, and arguments went back and forth, but based on people's own work or citations and references, which are broadly accepted. And if it's not broadly accepted, it could be a landmark study or something that could go against the grain. But it's all, again, rooted in scientific rigor. And at the end of this meeting, there would be a consensus report, which was also one of their more senior members did this and was able to formulate a report. And all of these meetings were extremely enlightening and very interesting. And again, this sort of group does this type of work for decades. Okay, so this is like the long preface of my own personal experience in this field and how the colleagues work in this field. So we're going to the ACIP meeting from last week, so Thursday last week, December 4th and December 5th. The day one started off with two presentations. One about the validity or the burden of disease of hepatitis B, and the second one on vaccine safety, vaccine safety of the hepatitis B vaccine. And I have to say, like I've watched mostly the first presentation. I actually kind of skipped through the second presentation, but the first presentation, which was presented by Dr. Nevison, who is a climate researcher, but who has been appointed by the Secretary of Health to present this case. And I can only say that, how can I say this as diplomatically as possible? I would say that this presentation is definitely not in the style of a type of presentation that I'm used to. Also doesn't refer to the sources as I would expect in more than 10 plus years that I've been in this field. And mostly it does lack scientific rigor. Parts of the presentation, there are certain data that showed, and then it's interpreted in a specific way, and a conclusion is drawn, but this conclusion is not referenced quite well, or is not. It doesn't take in sufficient context or references, or is just plain wrong. So that's like how I can describe it. I will try to be more specific, because because it's the CDC, everything is publicly available. So I'll just cite one of her slides that she showed. So in one of the slides, she said sources of decline in acute hepatitis B cases, and in this presentation, she said that acute hepatitis B is the most consistent reported metric of hepatitis B morbidity. Later in her presentation, she does give more data or more information on chronic hepatitis B, which is of course the most important burden of disease globally. With one of the other panel members later commenting that almost a third of the entire world population is chronically infected by hepatitis B. So it's a huge burden of disease, and it's a chronic infection that's the actual burden of disease. But just to give her the benefit of the doubt, she has this one slide, source of decline in acute hepatitis B cases, and she states increased blood testing for hepatitis B surface antigen, which is the thing you test for hepatitis B, sharp declines in post-transfusion hepatitis, which is true because there's more rigorous testing on blood products, cleaner practices in dialysis, which is also true, widespread adoption of safer sexual practices, this can be argumented against, Needle exchange, of course, also true. And screening and case management for hepatitis B surface antigen mothers. Okay, she lists these arguments as a decline of acute hepatitis B cases. And then the final sentence, and this is the most contentious one, in my opinion, universal birth dose contribution to acute case decline is likely very small. Likely very small. There's no reference on the statement, and then Dr. Nevison goes on to show NNDSS data, or National Notifiable Diseases Surveillance System data, where she shows universal dose start. You see the decline of the acute cases and then the chronic cases, which have been reported later. And then she continues to use this data to see, okay, there is a study, a quite old study from 26, which would, through modeling, predict an amount of acute cases. And then she says the empirical data is much lower than what the model suggests, and then draws a conclusion. One of the panel members, and I also personally, when I watched this and listened to this presentation, there's numerous reasons why this would be the wrong conclusion looking at this data. Like, for instance, one of the other conclusions that she says is that the perinatal transmission may be overstated, and because it may be like the modeling goes goes out of like a worst case scenario, and it's probably not as bad as it is. And she uses the empirical data as proof of that. The problem is that we do not see this in the field. Like, I personally have not seen this in the field. During the hearing, there was also like a testimony of a physician who has contracted hepatitis B from a horizontal transmission, which she also minimizes. And this scientist, personally, I think, draws the wrong conclusion and uses the citations in a very specific way to prove a point. That's the feeling that's feeling what I got, and it's completely against the type of scientific rigor that you would expect, usually at a CDC hearing. So yeah, I mean, as a comparison, so this is the meeting that happened last Thursday. And when I compared it to the meeting in 2018, where they also discussed viral hepatitis, I mean, first of all, the meeting was quite different. There were a lot more people present, and this meeting was much more in the style that I'm used to. You have a presentation which lists the state of the art, which would be a lot of the things that I would expect to hear, and then there is a vigorous discussion afterwards from all kinds of specialists in the field, and there are some arguments, some details to further improve policy, and if there may be a change necessary for policy, then it would be discussed vigorously. But this is what I would expect. And when I switch back to 2025, the style is completely different. Like, after these presentations were given, one of the first panelists who would give their opinion was Dr. Meissner, I believe, Dr. Cody Meissner, who had been the president of the American Association of Pediatricians. And he was trying to be succinct, but yeah, you could feel like that he had a lot of objections. I mean, he said so, that he had objections against the presentations. And it was quite contentious, and you could feel that the chair and also a specific other panel member, they would not be swayed by very simple arguments against these presentations. Like, for instance, against the safety of hepatitis B, there's decades of evidence. Have been billions of doses given of this hepatitis B vaccine, which has empirically proven the safety of the vaccine. And the question has been given actually by another panel member. This was Dr. Hibbeln, to the individual who gave the presentation on vaccine safety, which was, I forget, Mark Blaxell, who is I think he's a health consultant. He asked a simple question. It's like, can you show me data which shows which is contrary to the proven safety of hepatitis B vaccine, and he could not show it. Like he says that there are some cases of increased fever against this vaccine, and this has been repeated. This is a minor adverse event which is described in many vaccines, but this was the answer to that question. and then of course, Dr. Hillen says, okay, noted, or something, a very short and succinct answer. But like this sort of interaction is not what you would expect from ACIP or from the CDC. Again, this is usually a very scientific, technical, collegial, cordial meeting, but it's very heavy, it's very technical, but not in this way. This felt like almost like a parliamentary hearing or something. And also the governance of this meeting really, it didn't sit well with me. And as we all know, the day after, so last week Friday, this panel would move on to decide to scrap the universal hepatitis B vaccination, and only for the hepatitis B positive, so newborns from hepatitis B positive mothers. During the presentations, there were also like arguments showing that it's mostly migrants who have hepatitis B. This is actually true. So you could like frame this, this is maybe discriminatory, but this is, I mean, it's true. There are higher rates of hepatitis B in migrants. This was also something that I have shown in my own personal studies and I have published on. This is true, but again, it was kind of framed, in a grand scheme of the presentations. I mean, maybe I shouldn't say too much about it because it's factually true. But still, in the totality of the presentation, I don't know, it kind of smelled a bit iffy, to be honest. So yeah, I mean, it's very lamentable that you have to see that an institution like the CDC has procedures and meetings that are being held in this fashion, and that has this kind of outcomes. Right after that, I mean, I gave my breaking news update in my little podcast here, but the Viral Hepatitis Prevention Board, so the body that I was mentioning a couple of minutes ago from Professor Van Dam, has actually quickly moved to publish a paper which they actually have succeeded in publishing. I actually want to quickly cite it. So it's published in the Human Vaccines and Immunotherapeutics journal. And the title of the editorial is "The Viral Hepatitis Prevention Board supports the continued recommendation for universal hepatitis B vaccination of all newborns within 24 hours of birth." And this is a short but very well worded, balanced, and well cited reaction, which is just over one A4 page. And I can really recommend any listener to this reaction. The ASLD, so the American Association for the Study of Liver Diseases, has also issued a statement and also has published a call to action through their newsletter, in the hope that this recommendation will not be implemented, because this is a recommendation from ACIP to the CDC, and then the CDC will advise the Secretary of Health, who will ultimately make the decision. And we do hope that this does not follow through. Of course, also in my own personal discussions with my promoters, they of course all support this. Also, our local physicians also support keeping this universal vaccination. Of course, we here in Belgium, it's not directly affecting us because we still offer the universal vaccination. But again, the United States, especially prior to COVID and prior to the Trump administration, in my personal experience, but also in every medical scientist throughout the world, I mean, all U.S. institutions in terms of scientific rigor and scientific output and opinions, and all of our international platforms We have always looked at the U.S. institutions for guidance and support and inspiration. I mean, the CDC and the NIH were always like giants on whose shoulders we would gladly stand on, and also valued colleagues with whom we enjoy working. We still do, of course, but it really pains me personally that after COVID and after the first Trump administration, and this just continues in the second Trump administration, that it has fallen to this. And specifically in this case, so the hepatitis B vaccine, which has been proven for decades is safe. The risk to benefit ratio is so overwhelmingly for the benefit. You prevent a lifelong infection, which leads to liver failure, liver cancer, premature death, a lifelong infection to which we do not have a cure. We can successfully suppress it, but we cannot cure it yet. I mean, the immunology is still not fully elucidated. I mean, my promoter, Professor Wollekem, this is his field, and our research group, we are working on it, and a lot of our colleagues are working on it, but we cannot cure it yet. But we can prevent it. We can prevent it really well. And this universal vaccine is the best way to do it. Of course, in theory, if you would perfectly screen anyone, you may not need it for everyone, but this is an important safety net because we know that this screening is not perfect. And if you have a burden of disease which is high, and it's demonstrated that it's high throughout the world, then we need every tool we can get. And this universal, I mean, this vaccine is an excellent tool. And yeah, I hope they can reverse it, the Americans. I do hope it. And I hope it doesn't come, this kind of decision doesn't blow over to our shores. But I do believe, even if after listening to this hearing, there are still a lot of physician colleagues in America who are vigorously opposing this recommendation. One of them is, I'll gladly drop her name, is Anna Locke as well, who has been a previous president of the ASLD, and whom I had the good fortune to meet in Brussels, actually, because she was invited by Professor Van Dam on a joint ASL and joint NIH viral hepatitis prevention board meeting, I believe. And after the meeting, she had an afternoon worth of free time, and I just took her on a short stroll through Brussels and showed her some of the sites, and I was able to exchange scientific ideas with her, and also had a little bit of small talk, talked about our families and stuff, because I mean, she's originally from Hong Kong, and she's an extremely nice lady, but of course she's, as I mentioned a couple of moments ago, she's one of the giants on whose shoulder I have academically happily stood, and she's also, of course, opposing this recommendation. So yeah, so this has been the podcast of this week, uncharacteristically in English. So I apologize to all the listeners who may have found it a little bit difficult to follow, maybe because this has been in English. But yeah, I tried to structure my thoughts about this decision in the States, and it's very lamentable. I do hope that they can still reverse it. All right, so tonight we have our hospital quiz, which is a yearly tradition here in Turnhout. So we're going to do a little bit of work more, and about around 6 o'clock we're going to have some dinner with some colleagues, and then we're going to go to the quiz. So we hope we will do well, but it will be good times. All right, so see you next time. Stay safe, stay well, and good afternoon and good night wherever you're listening. Cheers. Bye-bye.